Paul Chehade, healthcare is one of the top social and economic problems facing Americans today. In the global context, the United States is one of the world's only developed nations that does not guarantee universal health coverage for its citizens. Paul Chehade. Healthcare is one of the top social and economic problems facing Americans today. In the global context, the United States is one of the world's only developed nations that does not guarantee universal health coverage for its citizens. I have a simple question for all United States citizens: should all Americans have the right to health care? The answer is yes. No one in the richest nation on earth should go without health care, because that improves public health, reducing the overall health care spending. That should be, in fact, an essential government service. Most Americans would agree that healthcare reform needs to happen, but the disagreement is on how a new healthcare system should be structured and funded. The biggest problem to the people when need health services are the fees. The majority of healthcare systems in the U.S. run on a fee-for-service basis. That means every doctor encounter, diagnostic test and/or medication expense is billed separately. A coding system is used to classify each service to a different cost level. Then the items are tallied by code and result in the final medical bill. A criticism of the fee-for-service model is that since physicians in hospitals make a cut of each charge, they are motivated to perform more services. This causes that more tests and services are ordered than it may be needed, increasing the charges to health insurance and patients. Here are some reasons why American healthcare is so bad. 1. Hospital mistakes and infections are still one of the leading causes of preventable death. 2. We spend the most. We spend more than any other country in the world. 3. We don't pay doctors according to the quality of their care. One of the first questions is, percent of primary care practices with financial incentives for quality. 4. Doctors don't have time to listen to their patient anymore. Instead, they have to spend their time filling out unnecessary papers and documenting rather than examining more in detail their patient, in order to get a small fraction of payment for their services and practicing defensive medicine in order to avoid lawsuits. 5. Food deserts. The U.S. still estimates 23.5 million people live in these urban neighborhoods and rural towns with limited access to fresh, affordable, healthy food. Without grocery stores in these areas, residents often have to rely on fast food and convenience stores that don't stock fresh products. 6. Technology has made do-it-yourself patient care much easier. This goes beyond just a patient's ability to look up their symptoms online. The government's job is to provide security and infrastructure that promotes individuals' rights to life, liberty and happiness, including education and healthcare, and is it very sad to say that being the U.S. one of the world's biggest countries, the healthcare system quality is declining so quickly. God bless America. Paul Chehade. Honor and Truth. For more information, please visit http://www.paulchehade.org. http://www.paulchehade.com/bc/iip20buz9. Company name: Paul Chehade, United States Presidential Candidate 2016. Contact person: Paul Chehade. Email: info@paulchehade.org. Phone +1 305 517 3605. Address: P.O. Box 450 1506, City, Miami State, Florida. Country: United States. Website: http://www.paulchehade.org.